Okay, so we are going to go through disorders of memory right now. As usual, let me just share screen. Give it a second. Okay. So we'll have an introduction as usual. We'll discuss the amnesias. We'll discuss the paramnesia, which are distortions of memory, and we'll discuss hyperamnesia. So disorders of memory then are categorized into the three: the amnesias, the paramnesia, and the hyperamnesia. Okay. So memory is the cognitive faculty of storing and remembering information. We won't get into a lot of the introduction because you've done a lot of it in behavioral sciences, if I'm not mistaken. So you've got your three types of memory: sensory memory, short-term, long-term. Please know where exactly these functions, these particular memories are related in terms of neuroanatomy, neurobiochemistry as well, okay? So you'll go through these tables on your own and what they mean. This is essentially your revision, all right? Okay, so let's get to the amnesia. So amnesia in itself can be understood as partial or total inability to recall past experiences and events, okay? And it can be psychogenic or it can be organic. So when we say psychogenic, we mean it's more psychological related, so like a dissociative amnesia, versus organic can be due to trauma, it can be post-ictal after a seizure, it can be neurocognitive in terms of the dementias, things like that. Psychogenic can also be related to illnesses like major depressive disorder or anxiety disorder. If you can remember at a point where you've been quite particularly worrisome or anxious more than usual, you can forget, exam time most of the time, right? So failure to recall can be due to normal memory decay, especially as we age. But even as we age, most people seem to think, Kwamba, the older you get, then it's natural to forget. But there's a level where it's normal forgetfulness, even with aging, okay? And then obviously, you were heading towards, a dementia. But it could also be due to proactive and retroactive interference. So proactive interference is whereby you learn something new, and that new information overrides what you already have in your memory stores and your memory reserves in the brain. Versus retroactive information is something you've learned previously that is hindering storage of new information, which can be quite normal actually throughout, the reading process and stuff like that, okay? So we talked about the psychogenic amnesias. We're just going to go into the organic amnesias a little bit. So you've got amnesias due to acute brain disease. You've got amnesias due to subacute coarse brain disease. Coarse it means organic. You've got chronic coarse brain disease and how they affect the amnesias. So with acute brain disease, perception, like the perceptual, modalities that we discussed last time in class, and attention is usually impaired, and this then affects memory. So if you can't pay attention, you can't register something, which means you can't learn. It means you can't code for it in memory. So learning and memory is are cognitive domains that go hand in hand. You can't store something if you don't learn it, okay? And you need to concentrate in order to learn successfully and then store it, which means then you need to have attention that's not impaired, all right? So they go, all together. So in acute brain disease, we usually have something called anterograde amnesia, which is a failure to encode new material into long-term memory, versus retrograde amnesia, which can also be seen in acute brain disease, is a failure to remember past events, especially usually just right before an episode or an illness or a traumatic event like a head injury or something like that. And then we've got blackouts. Most people seem to think blackouts are loss of consciousness. Blackouts are not loss of consciousness. Blackouts are periods where somebody has anterograde amnesia, but they are reversible, right? Most commonly can be associated with alcohol use. So for those who've used alcohol, unfortunately, this is a recording, so you can't raise your hands. but those of you who have been out, especially binge drinking, for whatever reason, really, you can wake up the next day and there's just a period where you don't remember the events of the night, and you just don't remember how you got to your room or home or that sort of thing. That's a blackout, okay? But you can continue encoding new memory once you wake up. You can remember other aspects of the night and that sort of stuff. That's a blackout. Loss of consciousness is not a blackout, right? With subacute coarse brain disease, you could also have both anterograde and retrograde amnesia, but remote or long-term memory is intact, right? So it is good. Immediate recall is also intact. So we make a diagnosis of subacute brain disease once we've ruled out an acute, possible brain disease, particularly in delirium. We'll do delirium in details later on, all right? Chronic coarse brain disease. Okay, sorry, going back. So as I mentioned, we make the diagnosis in the absence of cognitive impairment like a delirium or like an Alzheimer's disease. But here, mainly in subacute coarse brain disease, we talk of Korsakoff syndrome, which is alcohol-related, heavy, prolonged use. We talk of cerebrovascular diseases like strokes, transient ischemic attacks. We talk of things like memory issues due to MS, which is multiple sclerosis. We've got something called a transient global amnesia. Context of head injuries, electroconvulsive therapy as well can lead to subacute coarse brain disease. Then we talk of chronic brain disease and how it affects memory. So the recall or recent memory can be impaired, but over time, remote memory follows as well. So it follows something we call a Ribot's law of memory progression, which is something I really like to ask in the CATs and end of semester. So read up on Ribot's law of memory progression. It's in FISH, very easy to understand. Then here we talk of now Korsakoff syndrome as well, as it heads towards, a more chronic state. And we also talk of neurocognitive disorders like Alzheimer's dementia or Alzheimer's disease and other forms of dementias. There are amnesias also that are associated with things like anxious preoccupation, poor impaired concentration, generalized anxiety disorder, MDD, like I just explained. With MDD, there's a term that they use, pseudo-dementia or depressive pseudo-dementia, and it's a pseudo-dementia because it doesn't really fit a major or mild neurocognitive disorder criteria, okay? So it's not really dementia, it's a dementia-like clinical picture. And these usually resolve when you treat the underlying illness, the underlying diagnosis, or when you treat or manage whatever really is going on. So if you're anxious or you're preoccupied, and you take care of whatever is your preoccupations, or you compartmentalize, or you do your breathing techniques, your grounding, your mindfulness, your meditations, you see that the amnesia kind of resolves, right? So there are multiple paramnesias, particularly with distortions of recall and distortions of recognition, very easy to read. I'll highlight a few that are common in some particular disorders, and you can read about the rest on your own. So retrospective falsification is unintentional distortion of memory. It can be due to current emotional states or even cognitive states. Most people with histrionic personality traits, kind of have retrospective falsification. So they remember things that didn't actually happen, okay? So it can be an exaggeration of certain memories as well. False memory as well is that what we talked about, recollection of events that did not occur, but associated with actual construction of certain memories. All right. This can be an association with organic illnesses of the brain, but it could also be due to suggestibility. So some people are very easily suggestible in that you could actually make them remember things that didn't occur. You could actually make them hallucinate. They're very easy to hypnotize, stuff like that. So a lot of people with histrionic personality traits or people who are generally very dramatic, can experience that. Confabulations are falsifications of memory that occur in clear consciousness. So not a delirium, not a coma, not a disorientation, but they are definitely associated with organic pathology. So the patient tries to fill in the gaps because most of the time they're embarrassed that they don't remember. So whenever we find a confabulation, you're thinking organic pathology, okay? Pseudologica fantastica is essentially pathological lying. Can be associated with narcissistic personality disorders, can be associated with histrionic personality disorder, as well as antisocial personality disorder. And we've got Munchausen syndrome, which is a variant of pathological lying, but here people fake illnesses and symptoms, and they can actually recall in so much detail certain symptoms that they've had, all right? We've got Vorberadin, which can be related to memory, like we discussed, talking past the point. It's associated with a certain thinking as well in terms of approximate answers. So patients can understand what is being asked of them, but deliberately avoids the correct answer. And it can lead to a clinical picture that looks like a distortion of recall and memory, okay? Deja vu is not strictly a memory problem. It's actually more experiential related, but so these are distortions in the recognition of memory now, recognition in terms of memory aspect. So a lot of us have had deja vu. It's a pretty common experience, surprisingly. It's a feeling that you've experienced the current event already in the past, right? One of the theories is because there's an overlap in terms of storage and encoding of material between long-term and short-term memory to make you feel that way. But then there's something else we call jamais vu. These are French words. Jamais vu is a knowledge that the event has experienced before, but there's no feeling of familiarity. So it's kind of like there's no emotional familiarity associated with that, like in deja vu. So it's kind of like this has happened before, and you just move on from it. All right. We've got deja entendu, which is a feeling of auditory recognition, sounds, music, voices, you know, stuff like that. We've got déjà pensé, which is a new thought that is recognized as having previously occurred as an old thought, okay? So it's not necessarily an experience per se of you doing something or saying something or somebody else doing it, but something that you're thinking about. It's like, wait, I've thought about this before. I've been through this before, all right? Which is not necessarily a memory per se, okay? And all these, like I said, can be experienced by healthy individuals, but also people with temporal lobe epilepsy. Again, go back to your neuroanatomy of, you know, memory storage and encoding and the memory process. Then we've got something called false reconnaissance, which is a false recognition or misidentification of memories of people, of experiences. It could be either positive or negative. It can be associated with organic states, psychosis as well. So there's something called the Capgras syndrome, which we'll discuss in detail later on. But Capgras is otherwise known as illusion of doubles, whereby somebody believes that, so they perceive people that they know, and in that perception, usually visual and auditory, a belief, a delusion stems where this person has been replaced by a double, and usually to harm them, all right? Hyperamnesia is exaggerated registration, retention, and recall. It can be through flashbulb memories, flashbacks, and eidetic memories, which is very controversial. So you'll read about flashbulb memories, which I really like asking, but when we talk of flashbacks and flashbulb memories or hyperamnesia, they're usually associated with an emotional tone, a very strong emotional tone. So one that's associated with fear, for example, and they're stored in the amygdala, in the limbic system. So you'll find people tend to have flashbacks in the form of dreams or even like, you know, memories as they're sitting and doing something when associated with particularly strong emotional responses like traumatic events, so rape, or war zone areas, you know, people who've come from conflict areas. If you've been through traumatic experiences as well, like, you know, witnessing a death or almost experiencing death, you know, coming with near-death experiences like road traffic accidents, head-on collisions, and things like that, right? Eidetic memories are controversial because there's still a lot we really don't know about memory formation, memory encoding, just the memory process in general in the human brain. So eidetic memories are, excuse me, where people remember everything and anything associated with a particular situation. So if they read something, they can recall everything, even if they read it once. That's a photographic memory. But eidetic memories are, so they would also remember the smell of the book that they read. They would also remember if music was playing. They would also remember if they were chewing gum, then what gum was it, what flavor it was. If they glanced at the clock just for like 2 minutes during that reading, then they can remember what time it was, all stored very fresh and, you know, in the brain. So that on its own, people with eidetic memories, is quite controversial. Those of you who've watched Criminal Minds, there's a character in there, is actually my favorite character. His name is Dr. Reed, Dr. Spencer Reed. He's got like 4 PhDs, is it? He's got 4 masters and 2 PhDs, something like that. So his character has an eidetic memory, right? And it's the reason why, you know, he's excelled academically the way he has. But again, very controversial. Eidetic memories can be associated with certain substances, particularly hallucinogens. So, you know, the I can taste colors and I can hear numbers, you know, sort of thing. That group of substances. So you can unlock certain memories with hallucinogens, and you can remember the things as if they are, you know, the memory as if it is very full and fresh, you know, the colors being as bright as they were, the sounds being as loud as they were during that time when you were intoxicated, etc., etc. So yeah, don't forget to read the chapter on disorders of memory. Thank you.